Tara Hansen, a 29-year-old special education teacher, maintained a healthy lifestyle throughout her pregnancy. But after she gave birth to her son Brandon, she told her doctors she didn't feel right. However, since postpartum pain is expected, she was sent home. Her husband Ryan watched as his wife's complaints fell on deaf ears. And 6 days later, Tara died from something simple and preventable, an infection. The University of California at Berkeley, February 1st, 2018, documents that women die every day from pregnancy-related causes. The maternal mortality ratio has increased in the US, while it's declined in other countries. With 65,000 near deaths and 900 deaths each year. Which brings us to Marco Mentione, another young man who is now forced to balance the demands of raising his 3 daughters alone. His wife Yolanda died from a stroke after delivering their last baby. He shares with USA Today, July 27, 2018, "The girls ask when she's coming home, and I don't know what to tell them. It seems like a nightmare. I just need to wake up." We need to prevent maternal mortality and save thousands of mothers from suffering from things like infections, strokes, or paralysis. Because the birth of a child should not lead to the death of the mother. First, we'll identify the problem of maternal mortality. Second, we'll evaluate causes. And third, prescribe solutions. So that America is no longer what the Observer February 2nd, 2018 describes as the most dangerous place to give birth in the developed world. 21-year-old Simone Landrum was pregnant with her daughter Harmony. During labor, she knew something was wrong when a splash of blood became a stream. She almost bled to death, and thousands of mothers could face the same tragedy. More than 2 women die every day during childbirth in the US, despite having the most advanced obstetrics and emergency care found on Earth. Yale University, March 23, 2018, reports that every day, 2 women die, and every 10 minutes, 1 woman nearly dies. With a high maternal death ratio, Popular Science, April 12, 2018, states it's a reflection of how society views women. Board-certified OBGYN Dr. Puzio informs the Journal of American Medical Association, September 25, 2018, that women have no prior history of health issues, yet suffer from pregnancy-related complications during or just after delivery. Other risk factors that increase a woman's chances of dying from pregnancy-related complications include obesity, diabetes, cesarean births, along with increased stress throughout pregnancy. Charles Johnson now raises his 2 sons alone after his wife Kira died. He wept to CBS News August 5, 2018. "That was the last time I saw my wife alive." We're talking about a woman who was a marathon runner. I miss Kira. Black women in the United States have an even greater chance of dying during pregnancy, a 243% likely chance over their white counterparts. The New York Times, April 11, 2018, concludes that Black mothers die 3 to 4 more times more than white mothers, a racial disparity wider than in 1850, 15 years before the end of slavery, when Black women were still considered property. Even tennis legend Serena Williams suffered from pregnancy-related complications and tells The Guardian, February 21st, 2018, "After I gave birth to my daughter Olympia, I almost died. I consider myself fortunate." Pregnant again, Simone Landrum complained about headaches, swelling, and fatigue to her doctor. He brushed her off, handing her a pamphlet about preeclampsia, high blood pressure during pregnancy. Simone never understood her condition until months later, and a similar danger awaits other mothers caused by undiagnosed medical conditions, unprepared medical staff, and biased healthcare. Mothers are reluctant to share their symptoms with healthcare providers, and as a result, their medical conditions go undiagnosed. Self magazine, August 9, 2018 reveals that women have heart problems or other health issues that go undiagnosed, since doctors can write symptoms off as normal. Katie Kane was unaware of her increased chance of developing placenta accreta, a condition that leads to hemorrhage with each repeat C-section. She stresses to National Public Radio, July 29, 2018, "If I had known that this was a possibility, no way would I've done this. No way would I've risked my children losing their mom." Additionally, hospitals don't identify complications quick enough, preventing proper preparation of tools. The Pittsburgh Post-Gazette, June 18, 2018, exposes the Perinatal Quality Collaborative in California, recommends that every hospital that delivered babies to have a hemorrhage cart available, which is a toolkit with all of the necessary instruments to treat postpartum hemorrhage. No healthcare providers took action when Allie Laurie showed symptoms of a hemorrhage after giving birth to her son. The U.S. News, July 27, 2018, observes that there's a lack of action by centers of Medicare and Medicaid services to protect mothers. Finally, healthcare that's biased robs Black mothers of the medical care needed to save their lives. The Center of American Progress, April 11, 2018, argues that society views Black women as less worthy of sympathy and support, perpetuating bias on how they are cared for. Unfortunately, co-founder of Black Lives Matter, Patrice Concolors, reminds Vox, January 10, 2018, Black women don't receive the healthcare we deserve from the moment we are born, and our mothers didn't receive the healthcare they deserved. Simone Landrum requested a doula to be her source of information and support. Even after accidentally receiving a spinal dose of anesthesia instead of an epidural during labor, her doula provided her reassurance. That's much like her solutions, including educating mothers, implementing maternal mortality review committees, and training medical students about unconscious bias. First, education and easy access to healthcare is essential to stopping more mothers from dying. The Mercury News, January 15, 2018, encourages women of reproductive age to seek early and continuous prenatal care, to adopt a healthy lifestyle, preventing pregnancy-related complications and death. OBGYN Dr. Yassine Zeid illuminates in the Texas Tribune, April 27, 2018, that it's too late to start educating mothers on pregnancy after they give birth. Second, just over half of the states have an active maternal mortality review committee in place, but all 50 need to make women a national priority. The Hill, July 26, 2018, promotes that committees determine why women die from pregnancy-related complications to reduce tragic incidents in the future. Professor at the University of Texas, Dr. John Harkins, confirms to NPR Austin, June 6, 2018, airline pilots go through the same protocols and checklists every single time because they know it's the safest way to get things done. And our surgeons can do the same. Third, medical schools must train students about unconscious bias and how it can affect their clinical actions. The Houston Chronicle, May 4, 2018, advocates to overcome bias. It begins with training students early, back in medical school, about how their own personal prejudices can affect their patient care. Practicing OBGYN, Dr. Rakita Mino highlights, we can listen to all patients equally and provide unbiased care. First, we identified the problem of maternal mortality. Second, we evaluated causes. And third, we prescribed solutions to ensure America is a safe place to give birth. We need to prevent maternal mortality and save thousands of mothers from suffering from pregnancy-related complications, because the birth of a child should not lead to the death of the mother. While in labor and delivery, Dr. Domino cared for a woman who suffered from an embolism. The woman nearly died, but luckily, a collaborative team of healthcare providers jumped in to stop the bleeding and stabilize her. They saved not only her life, but also her newborn.